including the Department of Health, the Department of Forensic Sciences, and DC's Homeland Security and Emergency Management Agency. I acknowledge the presence of Councilmember Vincent Gray, who chairs the Council's Committee on Health. I'm here to provide a briefing on COVID-19 and its presence in the District of Columbia. Late this afternoon, testing at the Public Health Lab at the DC Department of Forensic Sciences yielded the district's first presumptive positive case of COVID-19, more commonly referred to as the coronavirus. To date, the DC Public Health Lab has monitored 11 patients. 9 of those came back negative, 1 is pending, and late this afternoon, testing yielded a presumptive positive result. Here's what we know and what we can share at this point about the presumptive positive case. A man who's in his 50s is a DC resident, started exhibiting symptoms in late February. He presented and was admitted to a DC hospital on March the 5th. At this point, he appears to have no history of international travel and no close contacts with a confirmed case. He remains hospitalized. With his test yielding a presumptive positive, DC Health has started its investigation in keeping with the CDC's guidelines. This investigation includes contact tracing and providing guidance on next steps for care. As has been reported, we are also aware of people who visited DC and then tested positive for the coronavirus outside of DC. We have been notified of an individual who stayed in DC before presenting himself to a Maryland hospital and then tested positive for the COVID-19. DC Health is conducting contact tracing of that patient and individuals of known contact. We are making our best effort to work with the health departments of states where patients test positive to understand if there was any exposure in DC. As you know, over a week ago, I signed a mayor's order that directed funding and personnel to monitor, prepare for, and now respond to the coronavirus. Our message to DC residents continues to be, help us present the spread of germs and stay informed. We established an updated coronavirus.dc.gov, with the latest information and guidance. Based on CDC guidelines, we're going to keep repeating some of the most obvious and impactful things we can do, including multiple times a day, wash your hands with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Avoid touching your eyes, nose, and mouth with unwashed hands. And of course, stay at home if you are sick and call ahead to a healthcare provider if you believe you are displaying symptoms. With that, I'm going to hand it over to Dr. Talwalkar, who is our Senior Deputy Director at DC Health. Then we will hear from Director Rodriguez, who leads DC's Homeland Security and Emergency Management Agency. Dr. Talwalkar.
Thank you, Mayor. Good evening, everyone. So while this is our first presumptive case, we certainly have been preparing for this moment in the district through the Department of Health, through HCMA, through a lot of our partners, making sure that everybody can stay up to date and aware with the most accurate and reliable information. So as the mayor had stated, our priorities right now are twofold. We want to continue the ongoing investigation of these cases. What that entails are detailed interviews with those cases to assess the risk of exposure to our community. We look at where they've traveled, where they have visited, who they may have been exposed to, the ages of those people who they may have been exposed to. So then we are best able to provide information to the public and recommendations about what some of our next steps are going to be. But Still, as the mayor mentioned, the most effective strategies we have are the ones that we have been pushing out since the beginning, and that is community hygiene practices. That is the best way that you can protect yourselves both now, before we had cases, as well as now that we do have cases. We want you to stay home if you are sick. We want you to wash your hands for at least 20 seconds. We want you to cover your cough or your sneeze, not with a bare hand, but with a tissue or with your elbow. And stay aware, stay informed, visit our website, and we will continue to push out the best information that we have about the status of our investigation, and where we go from here. Thank you.
Okay, questions on topic? Questions, Mark?
Mayor Bowser, will you be declaring a state of emergency or recommending that any events like the Cherry Blossom Festival be canceled?
I will evaluate that as we go along, Mark. I am not declaring a state of emergency today. As you see in some states, they don't have the type of unitary government that we have, and so all of the power that I need at this stage in our response, I have.
How about canceling events? You see South by Southwest was canceled, universities are canceling classes. Are you considering canceling anything, particularly the Cherry Blossom, which will attract a lot of international travelers?
I think South by Southwest pulled out, closed because people weren't going, sponsors weren't going, big groups were not going to South by Southwest. And then at this stage, our businesses, we're not canceling any events that the district is sponsoring at this stage, and we will continue to work with our private sector partners. We will work with the Convention Center Authority and all of our hotel partners to monitor this situation. We recognize that it is fluid, and every day we will monitor the situation on the ground in the district. We put safety of DC residents first. We're following the science that dictates how we test and how we will proceed. Yes?
What more can you tell us about this particular case? Do you believe that this is one of these cases of community spread where this person didn't necessarily travel or come into contact with someone per se? Also, how's this person doing? Is he expected to make a full recovery? And are there areas that he visited that people should know about for their own safety?
So Darcy, what we need to do, the Department of Health has now, it's in the preliminary stages of its interviewing and tracing. Additionally, they will work with the departments of health, other departments of health that may be implicated in the case of the DC resident is here, and also in the case of the person who visited here and presented at a Maryland hospital. So we're pretty preliminary in that, and you can expect us to share more information about their movements.
Can you say how he's doing?
I don't think that I can. I think that he's being treated in a local hospital, and that's really all I can say.
Mayor Bowser, the 50-year-old man also the person that visited D.C., did they go to APAC, CPAC, or did they have contact with elderly, children, and any other large groups?
I can't say any more about tracing their movements in total. I do not believe that they attended APAC or CPAC. I do not believe that either of them attended APAC or CPAC. Yes?
Mayor Bowser, John C. Fox 5. Can you talk about the availability of those test kits?
Absolutely.
In the health department in DC?
Sure. Let me first turn to Dr. Jennifer Smith, who leads the district's Department of Forensic Sciences, which includes our public health lab. We reported as of Monday, this past Monday, that we would be able to do our own test and have been doing them since Monday.
Thank you, Mayor. Yes, we do have, at this point in time, adequate kits to do the testing. Of course, we'll be keeping an eye on that as we get more tests in.
Can you tell us how many people you can test right now?
How many people we can test?
Yeah. How many people do you have the capability of testing with the test you have on hand?
Yes, so right now our capacity to test each day is about 50 patients. And of course, it's going to flux because one patient may have 2 samples and one patient may have 4 samples each. So we do, our first kit that we got had over 700 tests available to it. The second kit also had about 800. So we have quite a number of capability there to start doing that testing. We're also keeping an eye on this. We're looking at supplies. We are in contact with CDC, who can supply this to us. And then we want to recognize that private laboratories are going to be coming online. This will then enhance the capacity, though it won't be exactly the same test the CDC has authorized. That will begin to give more testing capability out there for individuals who might be seeking that test.
Is your understanding that any DC hospital can take a specimen?
So at this point in time, taking of the specimen would be one aspect of it, but then submission of that, they're going to need to have a laboratory to submit it to.
Anyone can submit, any hospital?
At this point in time, I'm not sure that that is quite there. And again, this is all evolving. So again, DC Health is in the best position to talk to that issue.
So obviously you guys have laid out guidelines for who gets tested. It's not anybody who has the sniffles can come in and say, listen, test me for COVID-19. There is one case that's floating around, a woman who traveled to South Korea. She went to GW this week, was at the emergency room presenting all the symptoms, and she said that the Department of Health advised her that she couldn't be tested even though her doctor advised it. So how do you know that there's not cases like this that could be coronavirus cases that you guys just aren't aware of yet?
Sure, so I'm happy to have Dr. Tallwalker talk about the CDC guidelines and how we're executing them. And then I'm going to invite Director Rodriguez to come up for a short briefing on our Homeland response.
So when we make the decision whether we want to test or not, the very first step for any patient who is experiencing signs or symptoms is to go to a healthcare provider to get evaluated. So that evaluation is a key to that process. Once a health provider has assessed the patient's symptoms, for a novel test like this, for a new disease like COVID-19, part of the information that we use is a combination of clinical decision-making as well as the best public health science. So that is why healthcare providers cannot directly order this lab by themselves. They make that decision in consultation with us, and the health department ultimately approves it, and that is because we are in such close contact with the Centers for Disease Control and Prevention. So we are adding the local epidemiology and the best science on the public health side to that experience of the provider. So we respect all of the healthcare providers in the district. All of them call us for ultimate approval of that test. So from our estimation of what we learned from the provider, what we know from the best science from the CDC, as well as what we know about that patient's course, we followed the case criteria that we used, which is consistent with CDC guidelines that allows for assessing risk based on their criteria as well as the that we have about what's going on in the district.
So can you speak?
Travel in order to meet that criteria?
So one of the conditions is it's either you have symptoms, signs or symptoms, fever and or cough or different symptoms like that, plus a history of travel to a level 2 or level 3 country. We also have a criteria for the symptoms and being a close contact of a confirmed case. And then finally, the third one, which was recently added in the last few days, given what was happening in the rest of the country, we have a definition for symptoms as well as being a resident of a long-term care or skilled nursing facility. And that is because of the extra risk to those patients. In addition to those guidelines, they are always going to be guidelines, so this is as much art as it is science. But we do case-by-case consultations and case-by-case decisions as well as we get the information from the healthcare providers and the patients to then go ahead and make that recommendation on whether that patient should be tested.
So just back to this one patient at GW that is basically trending on social media right now. Can you address that? I mean, foreign travel to South Korea, exhibiting symptoms, doctors at GW recommend that get the COVID test, and your Department of Health says no.
Right, so we bring a different perspective to that single clinical encounter. So when we look at travel history, we are looking at actual exposure to the communities where there is disease transmission spread in level 2 and level 3. An airport is not considered by CDC to be that kind of exposure. So there was South Korea, but the fact that it was only through the airport, that is the criteria that we applied, which is what we apply when we hear about any history of travel. We look at where they actually were in that country, where they were actually exposed to, what communities outside of an airport that they were actually experiencing to assess their risk.
Is there a possibility where?
And I'll just add, because I think you asked a question about symptoms as well. When we saw her, her symptoms were improving and she was afebrile, but it was a combination of these factors that led to our determination.
She was also in Thailand, and there's community spread in Thailand. Can you tell us that?
So Thailand is not on one of the countries that is on the CDC list, which is what we are following at this time. But that is constantly evolving and updating, and so we keep our guidance consistent with that.
What will it take until the criteria changes, until
The
airport-
criteria just actually changed during the last week.
For
And
it to
so,
include airports?
I'm sorry?
For it to actually include airports as well?
Well, that's the CDC determines how the criteria are updated. My point in saying that is that this is a fluid response. The CDC has changed its guidelines at least once. They may change it again. And the Department of Health always has the discretion to implement what's best for the district. So the point I want to be very clear about is I will be very sure that our health department has checked and double checked to make sure that we're making the test available to everyone who meets the guidelines, but if there are special circumstances that present, that they will get a hard look from us and be implemented to test if the situation warrants it. Yes, in the back.
Hey, Jennifer Arnold with WUSA 9. So if those guidelines change and then end up including some of these cases that previously didn't qualify to be tested, will health departments be reaching back out to these people then to say, hey, maybe you should?
We absolutely will consider that as we continue to respond to the coronavirus.
And I also wanted to ask
Yes.
real quick about OUC and any extra preparation that they're taking to make sure they can handle any influx of calls in 911 or 311 if people thinking that they might need to be tested.
Sure, and I'll turn to the city administrator or to Chris Rodriguez to add to this. But when we had our first cabinet discussion about our response, we talked about the change in protocol for our 911 operators so that they're helping to screen and refer people to our Department of Health or to have an ambulance come pick them up if those situations warranted. So we started that process. The CMA may have more information about our call volume.
Thank you. We haven't received a significant amount of call volume for COVID-19 through either 311 or 911, but all of our first responder agencies and support agencies have plans in place to staff up and accept volume if they need it, OUC included. And so part of their forward response is to adjust their staffing to any scenario that this requires. And so OUC would be prepared on the 911 side and 311 side to increase their staffing to respond to more calls if we should receive them.
Mayor Bowser, at the last press conference, either you or your Department of Health, Dr. Nesbitt, rated the risk for DC residents as low. How would you rate the risk today?
Well, Mark, what we're going to do, and I don't want to low high, what we're following is people who have been infected with COVID-19 and making sure that they're following appropriate protocols not to spread COVID-19. What I've told you is that we have one confirmed case. And we have another person who we think was in DC who presented in Maryland who's also a confirmed case. And what we see around the country is that we're seeing more evidence of people who don't have any travel history who are presenting with and testing positive for COVID-19, which suggests to us that we do have a virus that is spreading in the United States of America. And so we, like cities and states around the country, are making sure that we're talking to our residents about how to prevent the spread, staying home, isolating yourself if you have symptoms, and making sure that we all of us others are preventing the spread of germs. So that we're going to stay very focused on that. We also have all of our government agencies focused on the best preparation possible. And so with that, I'm going to ask Director Rodriguez to come up, who is responsible for helping the district be prepared for all manner of emergencies, including public health emergencies.
Thank you, Mayor. Good evening, everyone. As the Mayor said, for the last several weeks, if not months, we have been preparing for this COVID-19 incident, and that really began when we saw the virus manifest itself in China and then begin to spread to the United States. Consistent with the Mayor's order, a little over a week ago, the district's Emergency Operations Center was elevated to enhanced watch or enhanced monitoring, which means that the Homeland Security and Emergency Management Agency is beginning to organize and coordinate the district's preparedness, and now with this new phase into its response efforts. We will continue to provide products and briefings to the Mayor for any key decisions that might need to be made. But what's critically important as well is that the Homeland Security and Emergency Management Agency marshaling the resources of district government to support DC Health and, of course, our Department of Forensic Sciences as we move out from this incident. I also want to say that a lot of the coordination efforts just don't reside here in the District of Columbia or even in the National Capital Region. The Homeland Security Emergency Management Agency has been reaching out to and making contact with other cities across the country that have been impacted by this virus in order to learn some of the lessons from preparedness and response that are applicable here in the district. So we should also be thanking some of our counterparts from across the country, particularly in Seattle and San Francisco and New York, that even though they are also dealing with the spread of COVID-19, they're taking the time out of their busy schedules to talk to us and our teams to help us also prepare for that. So we will continue to prepare. We will continue to, under the Mayor's leadership, coordinate our preparedness and response efforts against this incident.
Chris, you said that you've been preparing for a couple of months for this, but then the other day you said you just ordered N95 masks last week. Can you tell us, first of all, if every DC paramedic and first responder is equipped with N95 masks right now, and how many you ordered, and why you waited to order them? The DC Fire Union tells me they brought this to the administration's attention months or weeks ago that they needed to be ordered, and I'm wondering why the delay in that.
So I wouldn't see it as a delay. When we saw that there were requests from the Fire and EMS Department for N95 masks, and we actually began to centralize procurement and finance under the EOC structure, we answered those requests immediately.
So can you tell us how many they have today right now? Are they
I can't, I don't want to speak for the Fire and EMS Department, but what I will say is we ordered 42,840 N95 masks that are set to be delivered within the next few days.
Mayor Bowser, can you tell us in detail about the second case that you mentioned, the age, condition, where this person had been?
Dr. Tawak.
Yeah, so this is a person in his 50s who is traveling here and stayed with family.
A person in his 50s, just like the first person?
Mm-hmm.
Male or female?
Male.
Where did he go when he traveled?
So we're still in the process of our investigation so that we can determine exactly where, so that we're conducting our contact tracing so that we know where he has been, and in consultation with CDC so that we can assess the risk.
Is he in quarantine?
He is currently hospitalized.
Could you clarify which case you're talking about right now? Because I couldn't hear the question.
This is the case of a traveler who was diagnosed in Maryland but spent time in DC.
And that is separate from what Maryland has confirmed already, or is that new, or how do you know about it?
I don't believe that Maryland has reported it. Some kind of reporting things that this person this person is not a resident of DC but traveled to DC.
And then reported in Maryland.
Yes. Yes.
Mayor, can you clarify on the first person, the first man in his 50s, under what category was that person tested if they had no international travel and no contact with other...
Let me ask DOH to respond.
So this was primarily somebody who was at risk for complications. So given his age and some of the underlying conditions, that was the primary reason after the case-by-case consultation.
Is there any evidence that either of these people work for the federal government in Congress or at the White House?
We don't have evidence at this time, but obviously our investigation is ongoing.
Yes. Lou?
Mayor, I wondered if one of your people or yourself might, Luke Chabarro, Washington D.C. What has to happen to require the closing of some public buildings or facilities? There's been reports that a whole school was closed because one student might have possibly been exposed. Is that an overreaction, or what are the plans for that?
Well, let me just say this. Anytime we present or we're confronted with a need to close a public facility, it will be to protect the safety of all DC residents, and it will follow the best science that we have. The last thing that we want to do is close a facility and it doesn't keep people any safer. So that's how we will proceed with those very difficult decisions. Yes.
And just to check, you have this presumptive positive case has to be confirmed by the CDC. Is that standard procedure that everything goes to the CDC for them to give it the actual
Yes.
positive?
Yes.
For now. Yes. Is there any, have there been cases that a jurisdiction is said to be positive and then the CDC comes back and says no, it's not?
No, there are not.
Just to clarify, so the first person you mentioned is hospitalized in D.C. currently?
Yes.
And the second person is a visitor to D.C. who's from Maryland and hospitalized in Maryland?
The person who traveled to DC, not from Maryland, but from someplace else, is hospitalized in Maryland.
Where are they from?
Nigeria is my understanding.
Rouser, can you tell us where the DC resident is from, what neighborhood, what quadrant? What
No, I cannot.
And then I asked you a few minutes ago if you would say the risk is still low, and you declined to say that. But your office just put out a press release saying that the risk to DC residents is low. So can you clarify that for us?
Yeah, I stand by my press release.
So is the risk is low?
I told you the 2 confirmed cases that we have. And as we have any more information, we're going to share it immediately, Mark.
When it comes to APAC, 2 cases now have been linked. There's one in New York, case in New York, and a case in LA have been linked to the conference of 18,000 people I think attended here in DC. Have you made any effort to contact those people, and what would have to happen in order for you to do that?
I can turn to our Department of Health to turn to it. As I understand it, the conference has contacted all of the attendees, and the DC Department of Health has also issued a statement based on what we know about the people who tested positive.
Do you consider that a case of community spread, or a case of community spread?
I'll turn to the Department of Health.
So we are in connection with the health departments who are associated with any positive cases that happen to come through the district. So in our conversations with the New York Health Department, we have concluded that we have determined that the 2 positive cases were not symptomatic while they were attending that conference. So that means they weren't having any symptoms when we interviewed them. The health department in New York interviewed them. So what that means, if you are not symptomatic, is that you have no identifiable risk for anyone who might have been exposed to you at that conference. Obviously, it was a large conference, and so that investigation is also going to continue to be ongoing as people traveled back to their homes. If they were to develop any symptoms or be tested, we would be in close communication with the health departments of those jurisdictions to then follow up and interview those patients to find out what their status was when they were actually in the District of Columbia, so we can assess our risk here from those conferences.
Next question, Mark. In LA, were they in Los Angeles? Were they asymptomatic?
So that is still an ongoing investigation, and we will be in communication with the California Department of Health. We do rely on those health departments to contact us when they are at the point in their investigation to do so, and we are in very close and almost constant at this point communication with many of them in order to get information expediently.
Mark, you have the last question.
So just to get clarity on the criteria for testing, is this set by the CDC? Is it set by the district? Can the district deviate? Can they expand the criteria to say, listen, we want to test a whole lot more people than what the CDC is saying or what other states are doing?
Okay, let me ask Dr. Carl Walker.
So it starts with the best science from the CDC, and then we are able to use local data and epidemiology to tweak those criteria to best serve our residents and our patients.
So everybody expect, as we learn more, that we will report more just as soon as possible. Thank you.